Since we're on such uplifting topics today, I'm going to continue that and talk a little bit about the worst foreign animal disease outbreak in the history of the country that unfortunately I had a front seat for, along with many of you and many others in Iowa and Minnesota and the Midwest who were privy to some of this. First, I want to set the stage before I get to talking into the details of the continuity of business permitting. Not that a lot of you need a reminder about what this was like, but just in case. In Minnesota, we lost more than 9 million birds to this disease in 2015. We had 23 counties that were impacted. So the red counties are the counties that we had where high-path avian influenza was diagnosed in 2015. And that was a total of 110 affected farms. Specifically, when I say affected, we had 104 positive sites and another 6 dangerous contacts. So that was 110 in total there. And Minnesota is the #1 turkey producing state. So this was very difficult for not only our agency, but our industry, all of those producers who were involved in this. And when we got all of these control areas established around our infected and dangerous premises, we had more than 5,200 square miles inside the control areas. And I can assure you that's a lot of premises that we were dealing with, 1,900 specifically. And to break that down a little bit further, you can see that we had 264 of those premises, which were commercial premises. And then on the next slide, I'll break that down even further so you can get kind of an idea of what fell inside there. So as you can see, we had obviously chicken as well as turkeys inside there, and we also had a slaughter facility inside there, which ended up causing quite a bit more permitting work for us. So we quickly had to stand up a permitting group, and we tried this outside of the EMERS2 database, which, as you guys know, a lot of people have been talking about EMERS2 and permitting. For the first couple weeks, we tried to do it outside of EMERS without much success because we needed to permit everything into, out of, and within a control area. And when you're dealing with that much control area, it became overwhelming pretty quickly. We started out permitting just commercial premises, but as our incident went on, we ended up having to do some work with the backyard premises because they had to move birds and eggs too as things went on, and they couldn't maintain, they couldn't just consume what they were producing. So we ended up having to work into permitting some of the backyard properties as well. So we did move to EMERS2, and we were lucky because Fred Bourgeois of EMERS was able to come and hang out with us in Minnesota for probably much longer than he wanted to, but we were very thankful for that. So he helped us get started in that. And every premises, as you guys know, that's in EMERS2 needs a PIN. And we did not have poultry premises in EMERS2 prior to this incident, so we entered them by hand, which took a lot of effort. And we had to get them in there by hand, of course, before we could even start thinking about permitting. We had to first have the premises in there. And you guys might have seen on the next slide, we had a template that we basically developed that allowed us to some degree automate the permitting process. This is similar to the template that we had developed the first few weeks of the outbreak, where we were actually trying to fill this in by hand to allow permitting from point A to point B. And with Fred's help, we were able to get this template into EMERS2 and start to automate this process so that once we entered permits and movements into EMERS2, we were able to spit out a completed document that was already pretty much set to go. You can go to the next one. Again, trying to lay the foundation for very much, there was a ton of effort that went into this, and that is what really spurred us, of course, into looking at things a little bit differently to see how we could streamline things for the future. So just state time in 2015. This excludes all of USDA's time. This excludes also our incident commander or our state veterinarian or anyone else that we needed to get input on with the permitting group. So this is directly just the permitting group. We had about the equivalent of 7 FTEs or full-time equivalents working on continuity of business permitting for this 4-month time span. Obviously, our time was put in much more heavily towards the beginning and tapered off throughout, but just to give you a rough idea, we were able to track how many state hours put in, and we don't have that many extra people for this, so this was definitely a challenge trying to figure out how we were going to even staff this initiative. So we had temporary personnel that we got from temp agencies that we helped to bring in to do this. We had personnel we brought from other state agencies that we helped to bring in, and it was a huge workload issue. So in total we had more than 900 permits, and what that basically comes down to is we had more than 3,000 permitted movement documents that were issued. So each one of these movements needed a document in hand in order to actually move from point A to point B. So more than 3,000 documents that we issued. And then on top of that, there was the feed permits and movements. We didn't issue specific documents for each individual one of those, luckily. And then USDA actually picked up all of our finished product permitting, and that, as we've talked about earlier, came down to a trade issue, where at this point they needed to permit all of the finished product coming out of the plants so that they could basically trace it all the way back to say that there was no evidence that any of that at any point had come in from infected premises. So some of the challenge that we saw was just trying to verify the permit conditions. So we used, secure food supply plans, lots of experts in trying to determine what sort of requirements do we need to list on these permits that we would ask the industry to do to try and decrease any risk of spreading this disease. And we came up with templates for all of these movements, but being able to actually verify that those conditions were being met became an impossibility when you're dealing with 3,000 movements in a 4-month time frame. We tried to have the signature from the industry on the permit, and we would try to get those permits back and make sure that the industry was signing off that they had met those requirements. Again, it became impossible for us to request that information come back to us. It was a logistical nightmare. The industry was too busy trying to ensure they were keeping up with all the new infected premises, all the new premises coming into control areas and everything that was going on. Asking them then to return those 3,000 permits to us wasn't possible. So we quickly decided we weren't going to do that. What we did is educate and hope for the best, that the people were reading the permits they were getting and understanding just how critical it was that they follow the conditions, mostly around biosecurity and things like that. And what we learned from that is that we need to have all of that education and all of that work done ahead of time. So what we're going to be doing, hopefully never again, but in the event that we need to do this again, what we'll be doing is making sure that every origin premises is a monitored premises before they even get to our permitting staff. And you can go on. And so what that means is an origin premises, or any premises which is in a control area and wants to be able to move any poultry-related products, has to first fill out the monitored premises questionnaire, and our disease reporting officer has to give them a monitored premises status in EMERS 2. Once they have that status, the DRO says that they're official, they're a monitored premises, then the permitting group can go ahead and look at any permits that they would like to request to move poultry or poultry products off of their premises. So that's step one. Permitting group gets any premises, any permit requests outside of this monitored premises status. The first thing we get to do is reject it. We're not even going to look at them. They have to be a monitored premises. So if you go to the next slide, what you'll see is just an example of the first page of this. Since the 2015 outbreak, industry, the Board of Animal Health, the Department of Agriculture, USDA, and the University of Minnesota have worked very closely to try to see how we can streamline a response for the future. This monitored premises questionnaire is one thing that came from one of the many work groups that was formed from this coordinated effort. This is a 3-page document, and it basically goes through a ton of different information that we want to capture, and also a way of forcing the premises to go through these questions themselves and think about these answers and make sure that everything's on board before we can even think about getting them a permit. So these will go to our disease reporting officer. Once the disease reporting officer signs off and approves it, they get that status in EMERS, and they're ready to go with being able to request a permit. I think we all know how important biosecurity is. We learned that, of course, if our biosecurity would have been different, perhaps this discussion would be very different. And unfortunately, that's something that remains on the top of everyone's list. And there's been lots of tools that have been developed to try to assist with encouraging biosecurity at the ground level. NPIP has come out with 14 biosecurity principles. And another thing that has come from this is Clara Brandt is a individual who used to work with the University of Minnesota, and she developed this poultry disease planning tool. You may have heard of this already. This right now is a tool that's specific for Minnesota producers, but it doesn't have to be. They are looking to expand it. If anyone would be interested in learning more about it, feel free to look it up online. Carol Cardona with the University of Minnesota is the contact for that. And if you go on to the next page, I'll just walk you through a little bit of it. Basically, what this does is it allows a poultry producer to go ahead and sign up to use the tool, and they can get their national premises number, they can get diagrams to lay out how their farm is set up and where they want people coming in, where they want people going out. If high pathogenic is diagnosed in Minnesota, what do? They walk through these steps to try and figure out whether or not they're affected or not, and how they can clamp down biosecurity on their premises. So we've heard good feedback. This again is an external tool. It's not from our state office specifically. It was the university that developed it. But we've heard good things, and we're hopeful that this is helping producers make this a real, concerted effort to actually try to kind of grab a hold and help manage this in the future if that would be needed. Another thing that had a lot of discussion in 2015 is the pre-movement isolation of birds to slaughter. This was brought up on many occasions, and unfortunately everything was moving so quickly that we weren't able to figure out the best way to be able to ensure that this was happening. So this has been brought up again with all of our work groups with the university and with industry, and we've outlined this a lot better now, and we are educating on it. The industry has been part of all this, so we do plan to enforce pre-movement isolation periods of birds to slaughter if this would again become an issue in the future, and you can see our timelines are set out there. Verification of testing requirements. This was another large challenge, as were so many things in 2015. And I'll talk about this verification in a few more slides as well. But what we learned from this is that we needed to perhaps not spend as much time on some of the low-risk products to be able to better utilize the staff time that was involved in the outbreak. So what we came up with, and what is consistent, with some of the food security plans, is basically trying to drop our poultry and poultry products into different risk category groups so we could determine how to handle those products based on their risk. And what we have is, for negligible to low risk products, those permits will come to the Board of Animal Health. We'll review them, as long as they're a monitored premises and everything, and everything pans out. There's no concerns with that. The permit will go ahead and get approved, and any subsequent movements that will happen under that permit. So the permit marks point A to point B, and it can be approved for a period of time. And then movements can occur under that permit, which are always from point A to point B. So what we are allowing for is that the industry will actually oversee those negligible to low risk movements under that permit, and any testing that's required will be the responsibility of the veterinarian or biosecurity coordinator for the industry to ensure that that's happening. So it'll take it off the state's plate, since these are considered low risk movements. Moderate to high risk, for example, birds going to slaughter, we feel that that isn't something that we want to move out to industry at this point. So we will continue to verify the negative tests for all birds going to slaughter in a future outbreak. And then we'll have this undetermined group. As we experienced in 2015, we will regularly get questions for things that you perhaps hadn't thought of, new things, different things, who knows. And we have a group kind of outline that will be involving university, industry, experts from different areas, and if we have a question of something that doesn't fit into a risk category, we'll be able to basically outsource this question to this permit advisory group, and they're tasked with doing all the research and answering the question as quickly as possible so that we can continue with our permitting to be able to not hold the industry back too much. So we've outlined how that'll somewhat work. And as I mentioned, just the testing verification proved to be very difficult. So in this map, as I mentioned earlier, blue is the unaffected counties. So counties in Minnesota that did not have high pathogenic. Red are the affected counties. So our state lab that did all of the high pathogenic testing is the MVDL, which, if you can tell, is on the eastern side of the state. It's in St. Paul. We don't have a huge poultry population in St. Paul. We have traffic in St. Paul. So what we did have as a major problem to be able to verify this testing is just the fact that we needed to get the samples to St. Paul to be tested. So we had couriers set up in various red areas, which are the affected areas, which is where the poultry industry is. So we had couriers that would get those samples together and they would drive them to St. Paul morning and afternoon shifts. Unfortunately, by the time the couriers from the afternoon shifts got to St. Paul and St. Paul had their 4 hours to get these samples set up, we would be getting test results at 10 o'clock at night. We'd be getting them at midnight, sometimes later than that. And when you have a guy on a truck with birds in the back who doesn't have his permit because you're still waiting on test results at 1 o'clock in the morning and permitting staff is trying to get that permit out, it can be kind of contentious. So that was not ideal. So if any of you guys can guess what our solution was, if you have $8.5 million lying around, you can perhaps do this in your state. On the next slide, we were lucky enough to be able to take the Wilmer Poultry Testing Laboratory, which is in the center of our poultry dense area, and make it a branch laboratory for the Minnesota Veterinary Diagnostic Lab. So we took a less than 4,000 square foot facility and made it almost 12,000 square feet. So jokingly, I realize this is not a solution for most states. We were very lucky in that we had this facility and we were able to utilize the land and that area a little bit differently to maximize the space and be able to build on and to have a new facility where we will be able to do high path AI testing in the middle of the poultry area, which will cut down on our waiting time to get test results fairly significantly. So this lab now is officially a branch laboratory. It's NIAA certified. They have 2 PCR technicians that are already going. They're already running tests out of this lab, and we're also busy training to make sure that we have surge capacity for the future out of St. Paul, and also thinking about how that will affect the Wilmer facility. So we're very lucky in being able to have this as a solution for us. And we are also planning to hire a poultry diagnostician out of this facility as well, which will be a huge advantage. And we have someone identified for that spot, but we're just having some difficulties getting him into the country. So we're hoping that that's fixed sooner rather than later. Other things that we learned in 2015 that we will plan to continue with because they worked very effectively is having a dedicated email inbox. So all permitting traffic is funneled through the same place. That works the same way for telephone lines. We had dedicated phone lines, so if people had a question, where's my permit, and they didn't feel like they could get a response via email, they could always call, and we would have permitting personnel who was specific to those email inboxes and those telephone lines to ensure that we kept things moving. Obviously, a streamlined permit process, and a lot of you have probably heard about the gateway. We've been working with Fred very closely and with industry doing training and providing feedback on the gateway and how to make it better and how to make it more streamlined yet, so that in the event it needs to be used heavily, we have that in place. We also have common workspace that was vitally important for our permitting group. They had to be able to interact and talk and work things out as issues came up. So we really found that very helpful, and we have common workspace already dedicated in our office in the event we need to do this again. And I put this in here about determining the time for test results because we don't plan on using a courier in the future. Now that we have our Wilmo poultry testing lab, we have mechanisms in place to safely drop off samples. However, if you do use a courier, I would encourage you to figure out what time you want to be able to get your continuity of business permanent movement documents out. Figure out the time you need those documents. Once you know what time you need your documents, talk to your diagnostic lab and say, I need my results at this time. You figure out what time you need the samples to your lab, and then the couriers can figure out what time they need to have the samples to get them to the lab. So work backwards. If you're looking at doing this for several months, which hopefully that doesn't happen again, but if it does, start from the end point and figure out your timelines backwards. As much as I would like to say, figure out what works for industry and how the courier should be set up, if you're looking at having diagnostic lab and permitting staff working until midnight, 1 o'clock in the morning for 4 months, it's just not something we can sustain. So we really need to start at the end and try to work backwards. And of course, another lesson we learned is we're going to pick up the phone a little bit quicker and ask for help from USDA and get them in there. Another thing that was crucial to our high path permitting group was the interactive map that was really quickly stood up for this outbreak. This gave us near real-time data, so the permitting group was able to find a prem of origin, a prem of destination on this map, be able to see if they were in a control zone or several control zones, just to be able to kind of visualize that, which was really helpful when they were talking to producers. We didn't necessarily have to worry about people finding different statuses in EMERS2 itself to figure out whether or not they were in a control area. They could just look it up on the map, which we found to be a lot easier for a lot of our permitting group. The downside about that map was that it was stood up really quickly. So it had a cap of about 10 to 15 users, and we sometimes had more people than that just working in our permitting group. And there were other people involved in the response that wanted access to the map. So it became a bit difficult when we couldn't have access to the map when we needed it. And another huge problem with the map is that it was only available to responders. We have a lot of privacy regulations that protect our producer data in Minnesota. And the producers wanted access to this map because they needed to participate in the response, which is accurate and completely a legitimate concern. Unfortunately, the way things were at that point, we weren't able to allow access to the map. So what we've done moving forward, and to solve this, so one of our lessons learned is we basically made a new interactive map. It doesn't have any of these restrictions that the earlier one does as far as how many people can be on it. And we also set up a system to be able to allow users to fill out confidentiality agreements to gain access. So every large company, poultry company in Minnesota has designated users who've agreed to maintain the confidentiality on that map, and they're then allowed to log in and have access to certain layers of the map. So they'll be allowed access to all commercial premises on the map, whether or not they're their own premises. So the companies have agreed across the board. Genio can see GNP, GNP can see Wilmer Poultry can see Gen. So they've agreed across the board that for the betterment of the industry, for a better response, they'll allow others to be able to see that data. And so far, that map has been terrific. If you go on to the next slide, we've done a ton of training on it. We can log into this map in real time or near real time. You will be able to see all of the premises information for all of the premises we have in our state database, as well as what's in EMERS2. So there's different layers to be able to see different things from premises data to the control areas to surveillance zones to infected premises and dangerous contacts. And depending on what your confidentiality agreement is, so depending on if you're industry, part of the incident management team, if you're the University of Minnesota, so there are different logins that allow different layers to be accessible to you. So we are able to protect the data as best we can while also allowing our industry to actually participate more proactively in a response. And there's a ton of different functionality we've built into this. One of the latest things we've built in is a directions tool. So someone can put point A and point B in, and then they can draw barriers, for example, infected premises, between point A and point B. And then the map will tell them the best route to take to try to avoid those infected premises. And this is another example of a tool we built in. This was a request from the industry themselves. So what you're looking at here is the ability for, let's say, a poultry company to go in to check that they want to see all premises in a control area, and then they can export that information in a CSV file, so they can take it out and open it up in Excel, and they can look at exactly what prems are in a control area. So they can say, they can filter it by their company affiliation, and then they can see these are the premises that need a monitored premises status that don't currently have one. Let's get those those questionnaires out to them, and then they'll also know which premises will need to have continuity of business permitting started if they're not already on that list. So it allows them to actually be able to visualize everything on a map, as well as export that data and be able to use it if they have their own systems they want to import it into, or at least at the minimum be able to visualize which premises are in a control area. Because that was a huge problem with the response in the past, is that a poultry company would say, well, it's really difficult for me to know at any given point in time what your lat long is for your infected prem, which isn't public, of course, so they have to hear through the grapevine, and then they're making their own maps and drawing circles and try to determine who fits in the circle. So this way we're all working from the same data, and it can provide for a more coordinated effort. Incident command system. So in 2015, we didn't really know what box we were in for permitting. Sometimes I felt like we were moved around into different boxes, so we never knew who we asked questions to. We just didn't have a defined place. And there was so much of the response that was happening so quickly that sometimes we felt like we were operating on an island. So a lot of times we would go directly to the incident commander or directly to our state veterinarian to try to get questions answered. Since we were developing continuity of business permitting as we went along, we of course had questions, and it would provide to be somewhat difficult sometimes not to know where to go with those questions. However, now in the FAD prep document, if any of you have seen that, that's specific to permitting, there is now a box there. So there's the planning section chief will actually have a permitting unit underneath it. So that has been defined now on the national level. And another issue in line with this, with the incident command system, is the trouble we had with case manager turnover. So in Minnesota, our case managers were specific to infected prems. So these are the people who managed an infected premises. And as we had new federal teams coming in, about 3-week stints, sometimes they would get assigned to be case managers for some of these premises. And then 3 weeks later, they would leave, and they'd have a new case manager assigned, which for the poultry producers themselves proved to be rather difficult, because they would lose track of who their case manager was because there was so much turnover, and they would try to call someone that they didn't realize had then left the state, and they may or may not get calls back. And for the permitting group, even though we were supposed to be continuity of business, we commonly were requested to do other sorts of permitting. So when we would try to contact case managers, it also became difficult because we weren't really sure how to get calls back from people who had left and who was new. And unfortunately, since permitting was a little bit secluded in our work, we didn't always have the most up-to-date information of who the case manager was, since there was this degree of turnover. So what we learned from this is we built our own system where all of our case managers are going to be state personnel. We have a lot of wonderful federal staff in Minnesota, but unfortunately they are not restricted to Minnesota. So we didn't want to be able to put them in a box knowing that they could be called out to respond in another state. So we made the decision to have only Minnesota case managers for infected premises moving forward. And that way there'll be a continuity for the poultry producer where they're going to know from day one that they'll be able to contact the same individual with questions on their premises. And now we also have a box. on the incident command system chart. So we still have some concerns. Linda Glazer and myself are involved with continuity of business permitting, and we're not sure that our placement in the chart will still work will work the way it's supposed to work, but we're hopeful at least we have a place, we have a box now, so maybe that'll get us a step further than it did last year. There was epi questionnaires that we had people fill out during the last incident, and we didn't really feel like that provided useful information for us, so we've decided to go without those in the future. Again, we were spending a lot of resources on low-risk products, and I talked a little bit about how we'll change that with having the industry participate in verifying any testing that would be required for those low-risk movements. The late-night testing and permitting, which, again, did not work, and we have mechanisms in place moving forward for that, and limiting the map to just the responders. So the industry has been very happy with the map, and I'm hoping that it will work as intended in the event it needs to be used again. So just a few things that we have in line for our theoretical next time is just making sure that the lab schedules are figured out. And as I mentioned, we're not planning on using couriers in the future, since we do have a branch lab now, and we now have 2 laboratories able to do PCR for avian influenza. So I don't think that that'll be an issue in the future. But one thing that we have decided to change due to research that has come since the last outbreak is we are planning to move our 2 negative PCR tests within 48 hours, the one being the day before shipment, to 11 bird samples instead of 5 bird samples. So that's been a change, a decision that was made. And I talked about the low risk movements already. And then also we've been working a lot with the industry to have a site management plan. So part of that is the poultry disease planning tool of just making everyone aware of the risks and kind of forcing them to think through, if they weren't involved last time, thinking through what it means for them to be potentially in a future outbreak and what that means for their farm. Do they have a biosecurity coordinator identified? Do they have a plan in place? And if they don't, they need to get that in place. So we've been doing tons of education on that just for preparedness. Otherwise, I think that we're as prepared as we're going to be. Our incident command post is ready to go. We have supplies for 2 months out, and we've got all of the dedicated personnel assigned, and I hope we never have to do any of it, but I know there are some of you in this room who are already involved with the next go-around. So, one other heavy thing I think that we learned, and our plan to move forward, is to making sure that a flock is down within 24 hours. So I think that was one thing. It's easy to say in theory, but when you have 6 flocks in the same day diagnosed positive, it becomes a lot more difficult to do in practice. So our goal is 24 hours to make sure they're down if this would ever happen to be an issue in the future, just to try to prevent any concerns with having the outbreak get out of hand faster than we can keep up with.